Thank you and good afternoon. And a happy Lunar New Year's to everybody. Gong hei fat choi to everyone. For today, we have 445 new cases that have been diagnosed with COVID-19, 6 of whom are epidemiologically linked cases, bringing our total number of people with COVID-19 in British Columbia to 72,750. Of the new cases, 135 are people in the Vancouver Coastal Health Region, 218 are people who reside in the Fraser Health Region, 15 are in the Vancouver Island Health Region, 44 people live in the Interior Health Region, and 30 are in the Northern Health Region. In addition, we have 3 new cases in people who normally reside outside of Canada. We now have 4,347 active cases across the province, of whom 226 people are in hospital, 61 of whom are in critical care or ICU. And an additional over 7,035 people continue to be under public health monitoring, with 67,008 people now recovered from COVID-19. Again today, unfortunately, we have 10 new deaths to report of people, mostly seniors in long-term care, who've died from COVID-19, bringing the total number of people in British Columbia to 1,288. Our condolences go out to the families and the care providers and the communities who have lost their loved ones during this very difficult time. We have one new healthcare outbreak in an assisted living facility, the Chartwell Carrington Place, where we have a single staff member and a single resident affected so far. And 2 outbreaks have been declared over at the University Hospital of Northern BC, where there were several units where had outbreaks, and at the Royal Columbian Hospital. And I do also want to note one of the outbreaks, one of the more tragic outbreaks that we've had in long-term care at the Jubilee Lodge in Northern Health was finally declared over yesterday, and our thoughts are with the community in that facility. We now have 16 active outbreaks in long-term care and assisted living and 6 in acute care units involving 541 residents and 344 staff. In addition, we have a new community outbreak in the Bruce Jack Mine in Northern Health. Since the start of our immunization program, we're now up to 162,982 doses of COVID-19 vaccine that has been administered in British Columbia, and of these, 17,562 people have received 2 doses of the vaccine. As we know, in the past couple of weeks, we've had very limited vaccine supply, but thankfully, starting next week, deliveries of our Pfizer-BioNTech vaccine will start to resume at much higher levels, and we expect to have a significant bump in supply in the coming weeks. This will allow us to fully resume our province-wide immunization program, focusing, as we have been in phase 1, on those most at risk of having severe illness or dying, and people who are in the front lines of our healthcare system. And we're very excited that we're going to be ramping that up in the next few weeks. And very soon we'll be able to expand into the community groups, particularly our seniors and elders. As I'm sure many people have noticed, we've also seen a notable decrease in transmission and outbreaks in long-term care and assisted living facilities as immunization has rolled out. And this is clear evidence of the effectiveness of the vaccines and extremely encouraging news, and I know a relief to everybody who has family members in care homes. As new cases continue to decrease in long-term care, we also need to continue to decrease our transmission in our communities. We are trending in the right direction, pushing our curve down, but slowly, and we need to ensure our success sticks. This means staying the course with our layers of protection and continuing to follow all of our public health restrictions and guidance. This weekend, we need to pay particular attention to ensure that the progress we have made is not wasted. And I think Mother Nature is going to be on our side there, where it's going to be a challenging weekend for many people to travel. This is even more important as variants of concern that we've talked about are circulating in our community. To date, we've had a total of 46 confirmed variant cases in British Columbia. 29 are of the B117, or the originally found in the UK, and 17 of the B1.351, originally associated with South Africa. In the past week and a bit, the BC CDC lab, in conjunction with our provincial labs, have been doing ongoing surveillance to help us better understand how many of these variants of concern, people infected with these variants of concern we have in the province. And they did what's called a point prevalence assessment, where we screened every positive case between January 30th and February 5th with a marker to see if they might contain this variant of concern. And of 3,099 positive cases that were screened, there were 3 that were confirmed by whole genome sequencing to be a variant of concern, one of which was a South African associated variant, and the other 2 were from the UK. So this is reassuring. It tells us that we don't have high levels of transmission in our communities, but that we still need to be cautious and continue to monitor. In addition, in the past week, we've identified another variant that is under investigation internationally and across Canada. We've had a single case of this variant. It's been associated with Nigeria and traveled to Nigeria. And the single case that we've had here in British Columbia was a person who had traveled to Nigeria. And it's being labeled the B1.525 variant, so it's a new one to add to our lexicon. We aren't entirely clear yet whether this variant also has increased transmissibility or causes more severe illness, but our lab team is working with their counterparts across the country and internationally to get a better understanding of what this can mean. The emergence of these variants, of course, makes us all concerned here in BC. They've shown in many places around the world that they do confer an advantage in that these viruses tend to spread more quickly, and now more evidence that they might cause more severe illness. As we have seen, the choices that we make today, as well as the plans we make for tomorrow, make a difference to all of us. We are in some ways playing catch up with this virus and breaking those chains of transmission, preventing that next infection, is what we need right now to buy us that time to get our immunization programs back up to speed again, and to help us give that protection buffer against these new variant viruses that are emerging around the world and here in BC. I know so many people in British Columbia are doing just that, doing their part every day. And you've chosen things like fewer faces and fewer places to keep your local community, your family safe. I know you'll be doing the same this long weekend, and I am so appreciative of that. Thank you to everyone. On this first day of the Lunar New Year, it's a time to reflect on the challenges that we have overcome since this time last year and the progress that we have made. It's also our time to look to our brighter days ahead. I hope everybody has an enjoyable Family Day weekend, and please remember to be kind, be calm, and to be safe.
Thank you very much, Dr. Henry, and I want to join Dr. Henry and on behalf of the Premier and the government, really the people of BC, to pass on my condolences to the families, the friends, the caregivers of the 10 people who passed away from COVID-19 in the last 24 hours in BC, many of them in long-term care as we deal with outbreaks that occurred in long-term care in November and December and January that are ongoing. I wanted to note that we have 226 people currently diagnosed positive for COVID-19 in acute care hospitals across BC. That 61 of those people are in ICU at present. And if we look at the overall hospitalization rate for obviously COVID-19 and all the other things that people that bring people to hospital, our base bed occupancy rate is 90.3%, leaving us 910 empty base beds in our hospital system. 72% occupancy rate amongst all beds. That includes the significant number of surge beds that were added to prepare for COVID-19. That leaves 3,337 beds. In ICU, our occupancy rate is 77.1%, which leaves 122 ICU beds available for new patients that are effectively empty at present. And our occupancy rate, including ICU surge beds, is 54.7%, which is 344 additional beds that are currently vacant. So that situation continues as it has been. That doesn't mean that, especially in hospitals in BC, such as St. Paul's, such as Royal Inland, there aren't profound stresses as there are in all of our hospitals as a result of COVID-19. But we continue in our acute care sector to have the ability to manage that. Dr. Henry talked about the 162,982 immunizations that have taken place in BC, including 17,562 who received both doses. As Dr. Henry noted, that we are expecting over the last 3 weeks, we've received about 21,000 doses of the Pfizer vaccine over 3 weeks. And next week, we are expecting to receive considerably more, according to the federal government, 54,990. And obviously, because we're doing both first and second doses, and because of the interval, a majority, about half of the Pfizer immunizations in the coming week will be second doses. And most of the Moderna, which has also been slowed, as all of you will know. But what we're hoping to do and continue to do is continue to now complete second doses in long-term care. And Dr. Henry has spoken about the extraordinary success of immunization in long-term care in BC, and we want to acknowledge everyone who is part of that effort, and obviously move on there to second doses, and that is what's happening. So those are that gives you a sense of what to expect. In this briefing every week, we bring you up to date on progress on our surgery renewal commitment. As people will know, non-urgent surgeries were canceled now March 16th to May 17th in BC. That health authorities resumed non-urgent surgeries on May 18th and have completed a total of 244,245 surgeries as of February 7, 2021, of which 191,120 were urgent and non-urgent scheduled surgeries, and 53,125 were unscheduled or emergency surgeries. With each week we build on these achievements. Our surgical renewal progress shows what is possible when we come together as healthcare providers, administrators, and community members, and I, for one, am grateful. And with that, here's the latest weekly report. The total surgeries completed by health authorities since May 18th, it's 66,675 in Fraser Health, 45,136 in Interior Health, 14,012 in Northern Health, 57,961 in Vancouver Coastal Health, 50,641 on Vancouver Island, 9,820 in the Provincial Health Services Authority. Weekly totals of surgeries completed from January 25th to January 31st was 7,314, or 165 more surgeries than in the same year last year. And we are so appreciative for everyone who's worked on this initiative and who are making this ongoing progress possible, and know what it means to families everywhere. This is a significant weekend for many people in British Columbia. The beginning of Lunar New Year celebrations, of course, today. Gangay Fachoy, Shukmung Namoy, to everyone out there. And I want to express my appreciation to the Chinese Canadian community in Vancouver, in Greater Vancouver, in Richmond, and all of the communities across BC, the Vietnamese community, Canadian community, and many other communities celebrating Lunar New Year, who have been, as communities, extraordinarily committed to following provincial health guidelines, who have been leaders in that regard. And I know that this weekend We are going to celebrate in our community's Lunar New Year's in a way that's safe for everybody, and I appreciate everybody's contribution to that. Sunday, of course, is Valentine's Day and then Family Day, which means that we have to understand the need to operate and to continue to operate differently, consistent with the pandemic, to make this BC Family Household Day long weekend, gathering only with those that you live with. And if we're on our own, it's one or two people we've been with all along. COVID-19 and its variants mean we cannot vary our COVID fighting routine. COVID-19 is all around in BC. You see that in the numbers today. So for us, it's essential travel only. Low risk is where we need to be, and staying local is the way to get there. That means we need to, that until COVID-19 is in the past tense, we must live in the moment and keep using our COVID sense. This weekend, next weekend, and beyond, let's make it a happy and safe Lunar New Year and BC Family Household Day long weekend. Let's use our COVID sense. Let's stop the spread. Let's play our key role in the vaccination plan. And by doing all of that, to save lives together and to celebrate our families, our communities in these extraordinary and important days.